Hello everybody, we are coming to you from a creative arts and culture harbor of Estonia, creative center of Estonia in Tallinn, and this is the e-health conference of Estonian presidency at the European Union, and we continue now with one-on-one discussions. My first question is from Wales, the lawyer and the e-health expert, Mr. Bleddyn Rees. You just told the conference about the task force to lay it on the e-health topics. What exactly your task force managed to do?
So we're looking at the legal framework for the delivery of free flow of health data and second use. So it's what can we do in a legal context to facilitate that free flow of data across Europe.
How much hurdles you have to kind of overcome before this free flow becomes reality? We heard Estonian former president, Mr. Ilves, yesterday. He said that it took 5 years to overcome some hurdles between Estonia and Finland to share their prescriptions. That starts next May, but we are looking at the whole continent. The legal framework, that's a very difficult hurdle.
But it doesn't have to be. So I'm a passionate believer that law can be a force for good, that regulation can be a force for good. It doesn't have to be about stopping things happening. It can be about facilitating things happening. The problem is that the European Union has no power to harmonize health laws so that national health systems become insular. They are not leveraging the global learning, the global business environment. So the idea is to create an international treaty, a convention that allows countries to start to harmonize, if they so choose, some of the fundamental rights around data for citizens and patients, and to facilitate then that flow of data for the benefit of individuals and society as a whole.
So our dream is to have a Europe where you can get a prescription in Estonia and fill it, let's say, in Spain.
Yes, but that's only part of the dream. The idea is that the future of healthcare, making health systems sustainable, is about using data. It's about learning from data, whether that's developing new services, whether it's about research and understanding the causes of disease, but it's also about enriching the understanding by adding, if you like, data from smart cities, data that isn't purely healthcare, and then learning from that to develop systems that are patient-centric, people-centric, that keep people well. It's about well-being as much as it's about disease. But the fundamental driver of this is data and the flow and use of that data.
We hear about a lot of goodwill in Europe about becoming e-health continent. But how much skepticism there still is in Europe about the free flow of data, about having the data available, accessible on internet rather than on papers. So how much skepticism you have to overcome? In Estonia, we are kind of convinced that this is the future. The future is already here. But in some parts of Europe, it's not that.
And that's a very fair point. And the, if you like, the contrast between the countries in Europe about how advanced they are, but also their citizens and their understanding of digital. So the more that a country is digitally enabled, its public services like Estonia, the easier it is just to see digital health delivering every day of the week. In countries that are still primarily paper-based, then the challenges are greater. But the key to this is communication. It's about explaining to people what the benefits are of the use of data and its transfer in a very practical way. So not just about research, but actually how is it going to help you, your mother, your father, get the services that they need in the most convenient manner. And once people understand the limitations on paper, the benefits from the digital enabling health work system, the quicker people will buy into it. And that's the whole concept behind the Digital Health Society. This is something that for you and I, for our children, our parents, it just makes sense. Why wouldn't you do this? And whilst there are concerns that people have, that's entirely understandable. But these concerns can be addressed in terms of the latest security that's around for digital. but also understanding that some of these concerns exist with paper systems. I gave as examples paper breaches by healthcare systems, which are just as prevalent. So sometimes this is what I would call a worried well syndrome, that actually the people who are ill, you'll publish your entire medical record, for example, online, because you're looking for a solution that gives you a good night's sleep, that reduces the pain that you suffer. So the reality is that there's a big disconnect between the people who are well, who are worried, and actually the people who are ill, who will definitely want some of these systems now.
Thank you very much for this insight. We hope that this conference is a good vehicle to kind of deliver this message to Europeans that this is our future, and we actually have to be optimistic about this future, not worry about this future. Have a good conference and have a good stay in town. Thank you.
Thank you very much.